Hello everyone, and welcome back to our Hygiene Connection, where we will discuss the importance of your oral health, the role that it plays in the oral systemic link, and in your overall health. Today's video will focus on the link between periodontal disease and certain cancers of the body. According to the American Academy of Oral Systemic Health, patients that present with active gum disease are at a higher risk for head and neck cancers. Gum disease affects 1 out of every 2 Americans over the age of 30. Gum disease is 2.5 times more prevalent than diabetes. According to research that was done by the Oral Cancer Foundation, 54,000 Americans will be diagnosed with oral cancer this year. Out of that 54,000, 9,750 will result in death. Oral cancer has a tendency to metastasize to other areas of the body before it is detected, which lends to a poorer prognosis for the patient. So you can see how important it is to make the commitment for you to visit your dental healthcare professional on a regular basis, so the dentist and the dental hygienist have an opportunity to examine your soft tissues and catch any type of infection or disease in the early phases. So please make that commitment to yourself. So what are the common factors that link periodontal disease with certain cancers of the body? Well, they have found through research 2 common factors to be, number 1, bacteria, number 2, inflammation. We know that when bacteria is present in the oral cavity, that's what triggers periodontal disease. And when periodontal disease is active, it triggers a systemic inflammation. Just like if you were to have infection any other place in your body, it triggers a systemic inflammation. When the systemic inflammation takes place, the inflammation then triggers chemicals to be released in your body. Some of these chemicals that are released have a tendency to be carcinogenic. They have found through research when they have examined tumors that were present in patients that have head and neck cancer, when they examined these tumors, they found high levels of a bacteria that we've discussed already many times, high levels of Porphyromonas gingivalis. Porphyromonas gingivalis bacteria is one of the leading bacteria in periodontal disease. Now, Johns Hopkins, through their research, they've also found a heightened link between patients that present with periodontal disease and lung cancer, and also colorectal cancer. They're attributing this to having the bacteria in the oral cavity and breathing the bacteria down into the lung cavity. Also, when they've examined tissues on patients that are positive for colorectal cancer, they have found high levels of another bacteria that is linked to periodontal disease called Fusobacterium. Along with Porphyromonas gingivalis, both of these bacteria are very high in the oral cavity when periodontal disease is active. And they have found this Fusobacterium in these malignant tissues of patients that were positive for colorectal cancer. So I can't stress to you enough how important it is for you to keep those dental visits. So we are in there examining your tissues and detecting any type of disease that may be starting. So we invite you to please pass these videos along. We hope you find this information beneficial. Pass these videos along to your friends, your family, and together as a team, we can ensure overall good health for our friends and for our loved ones. So until next time, please be well, and we look forward to seeing you in your beautiful smile in the office. Take care.